All right, so welcome to our next whole body migraine assessment call. So just a quick recap, if you haven't ever watched any of these videos, this is the whole body migraine assessment call is basically where I review information provided by somebody who signs up for one of these free assessments. And I evaluate their situation based on their symptoms, looking for patterns that their symptoms are revealing that could indicate some of the underlying imbalances that are contributing to their migraines. And so that will help us identify some of those unique biochemical issues going on for the individual that we're assessing that could be contributing to their migraines, to give you a little bit better idea of exactly what might be going on and how to better treat it. So today we have Amber. So Amber shares that she was in a car accident in 2018, and about a year later in 2019, she started having some pretty significant head and neck issues with the daily migraine starting. She has some nausea with it, but nothing she's found makes it better or makes it worse. So that's basically the information that she's provided. So Amber, let's talk a little bit about what might be going on. At this point, I'm sure that a year past the migraine or a year past the accident, you were probably given some sorts of therapies and physical therapy, maybe some massage and that kind of stuff. I'm not sure if that is the case or not. That information wasn't provided, but definitely these are going to be most likely cervicogenic migraines, which basically means that muscle tension and pain stemming from the neck and possibly inflamed nerves as a result of the accident are most likely what's going on for you. And so we're going to want to look at a lot of the things that we can do from a musculoskeletal structural part. So for example, one of the things is to take a look at diet. So are you eating a largely anti-inflammatory diet, things that we could potentially use to help reduce inflammation in the body that's going to help reduce muscle tension? So that's one thing. Things like magnesium and calcium can help with muscle relaxation. Deep breathing and making sure that you're getting plenty of oxygen to those muscles can help to relax them. So those are some of the things that you can do from kind of a day-to-day standpoint, right? Then there's other supplements like, let's see, wood betony, which is an herb that helps to relax the skeletal muscles. So the muscles in our neck and arms and legs and shoulders and things. Doing things like acupuncture, chiropractic, massage therapy, Reiki potentially being far enough after we're about 3 years after your accident now. So that could potentially be good, but doing some sort of a physical piece is going to be necessary. If you haven't done acupuncture, I would highly encourage that, specifically muscle trigger point acupuncture. So this is kind of almost a bastardization of the traditional acupuncture. And some of the traditionalists they would scoff at, you asking about the trigger points. But when we're looking at potential longer term inflammation and knots and damage from a trauma, that can be a really useful way to help break down some of the fascia that might be scarred around the damaged tissue and help to break down some of those chronically tight, contracted muscle fibers. Okay. Another thing that I would highly encourage you to do if you haven't already is pursue a NUCA practitioner the NUCA practitioner is a chiropractor who specializes in the upper cervicals with a special technique. So they're NUCA certified. That's NUCCA. And really assessing C1, C2. So those are usually the ones that are involved with migraines and are often very involved in car accidents, especially like whiplash situations. Now, you didn't really explain what the car accident was. I don't know if you were T-boned or head-on or rear-ended or what it was. So if we're dealing with a whiplash situation, that's kind of what I've been addressing. If it was a little bit more severe than that and you had a concussion, you lost consciousness, you had some sort of head trauma, then we're looking at something a little bit different. So in those cases where you have head trauma, you have post-concussive syndrome, maybe a traumatic brain injury diagnosis, looking at a physiatrist is going to be really helpful. So this is a specialized neurologist who really takes a look at the trauma that happened with the brain and has a combination of neurofeedback, biofeedback type of things that you can do to kind of help with how there's inflammation in the brain, as well as looking at things like physical therapies, medication options, things like that. So that could be another option if you know that you had a concussion or you lost consciousness. And then, of course, we want to make sure that we're utilizing therapies such as physical therapy as well to ensure that the muscles are aligned properly. Ultrasound to those tight muscles can help to kind of break apart scar tissue and help with mobility of the neck. And then, if you've had a workup done to see if there's anything, 3 years post, you could potentially have some, facets, little joints in the neck vertebrae that could be locked, that can be pinching nerves. So making sure that, I'm sure that at this point you've had x-rays, you've had MRIs, making sure there's no impingement on the nerves themselves is going to be very important. And then just working on the physical therapy to strengthen, the muscles around the neck and helping to relax those things as well can be helpful. So hopefully some of those things were helpful for you, Amber. Maybe some new words and some new specialists in there that you haven't heard of before. And if there's any additional information that you have regarding, regarding your MVA or your car accident and other things and therapies that you've tried that either have or haven't worked, the more information I can get during these calls, the easier I'm able to kind of point you in the right direction. So for people, for anybody else besides Amber who's watching, one of the most important things I always like to mention at the end of every whole body assessment call is the fact that we don't want to just eliminate, evaluate the issues and then eliminate those issues. We really need to work on alleviating. So we're healing, we're just not treating the symptoms. So a good example of that, when I mentioned the anti-inflammatory diet, we don't want to pull out a bunch of different foods and be, super restricted for the rest of our life. We want to actually heal the gut and make it so that you can actually enjoy gluten and dairy in moderation, and sugar and alcohol and whatever else it has, so that it's not something that triggers you automatically. So healing up the gut and healing those pathways that are out of balance are supremely important, so that you're not living a life of restriction. You're actually able to open up your life to doing all the things that you want to do. So hopefully that was helpful. And if you guys have any questions, feel free to leave them in the comments below. If you're interested in having your own whole body migraine assessment done, then you can click the link in the description below and choose your own time to sign up for your own whole body migraine assessment.